we talked about the pathophysiologic mechanisms of anemia, and we classified them into hypoproliferative versus hyperproliferative. But clinically, we go by another classification. To diagnose anemia clinically, you need low H&H, low hemoglobin and low hematocrit. And then there is another important blood index value that you will find in the CBC, complete blood count, which is the MCV. MCV, mean corpuscular volume or mean cellular volume. Normally, the average size of the red blood cell is somewhere between 85 to 96 femtoliter. This is the normal size, or what we call the normocytic. If you have a patient with anemia, low H&H, and the MCV is less than 85, we classify this anemia as microcytic anemia. If you have a patient with anemia and the MCV is more than 100 femtoliter, this anemia is a macrocytic anemia. If you have a patient with anemia, yet his MCV is anywhere between 85 and 96, that's to say normal size, we call this type of anemia normocytic anemia. And consequently, we have three major clinical types of anemia, what we call Winthrop's classification of anemia. We classify anemia based on the MCV into microcytic, macrocytic, and normocytic anemia. Another value we take into consideration, but we do not classify anemia accordingly, is the MCHC, the mean corpuscular hemoglobin content. If the red blood cells have less amount of hemoglobin, we call it hypochromic, and we don't have hyperchromic anemias. So anemias are either normochromic with a normal MCHC or hypochromic with a low MCHC. And whenever you have hypochromic red blood cells, they will also be microcytic, because the red blood cell contains nothing but hemoglobin. If it contains little amount of hemoglobin, definitely it's going to be smaller in size. Another parameter you will see in the CBC is the RDW. What's this RDW? It's the red cell distribution width. Now, normally, your bone marrow does not have this cookie cutter machine. So your bone marrow, when it manufactures red blood cells, the red blood cells come out of the bone marrow with different sizes. This is kind of a normal variation, and we allow up to 15% variability in size. This is the normal RDW, up to 15%. But when you have a microcytic anemia evolving, microcytic anemia in process, iron deficiency anemia, deficiency of iron, so the bone marrow will start making smaller red blood cells, and you are going to get size variability beyond this 15%, and this will cause elevated RDW. Same thing when you have B12 or folate deficiency, your bone marrow will start making macrocytic cells, bigger cells beyond the 15% variability range, and again this will result in elevated RDW. So the elevated RDW is going to tell you, hey, you have an anisocytosis. You have red blood cells of different sizes beyond the allowed normal range of variability, and this is a sign of evolving anemia, and most commonly seen in iron deficiency anemia, B12 deficiency anemia, and folate deficiency anemia. Notice, elevated RDW does not tell you, are these cells bigger or smaller? You have to look to the MCV.